An alarming headline tonight. We have seen it in other countries, and now what's believed to be the first case of reinfection here in the U.S. Here's ABC's Kaylee Hartung.
Tonight, doctors in Nevada confirming the first known American to be reinfected with the coronavirus. The 25-year-old man first got sick in March, but recovered, even tested negative twice. But 48 days after the initial infection, his symptoms returned. He had to be hospitalized, this time with a different strain of the virus.
There's a danger that even if you've had it, that your immune system may not protect you from a significant illness the second time.
It comes as crowded scenes like these are shared on social media, raising alarms. From this college party in Georgia to a rave in New York. Tonight, a new crackdown in Los Angeles. The city filing criminal charges against 2 TikTok stars for hosting these packed house parties in defiance of local health orders.
If you have a combined 19 million followers on TikTok in the middle of a public health crisis, you should be modeling great behavior, best practices for all of us, rather than brazenly violating the law.
Bryce Hall and Blake Gray could face up to a year in jail. Before being charged, Hall told TMZ he immediately regretted it.
Was not expecting that many people to come. It happened. Our power got shut off. I deserved it.
And David, tonight there is more pushback and downright outrage from thousands of local health officials over those new CDC guidelines that say if you've been exposed but don't have symptoms, you don't need to get tested. They cite the CDC's own data that suggests up to 40% of COVID cases are due to asymptomatic transmission.
From Hong Kong this morning, the first confirmed case of a patient contracting the coronavirus a second time. Doctors report the patient, a 33-year-old man, was first diagnosed with COVID in late March. His condition then required hospitalization, though the case was mild. Then, 4 months later, reportedly after returning to Hong Kong from Spain via the United Kingdom, he tested positive again on August 15th and was hospitalized but is asymptomatic. The findings suggest that some patients who recover from COVID may have only short-lived immunity from reinfection. But experts say there is no cause for panic and the reinfection is common with other coronaviruses.